Hi everyone, and welcome to Health and Beauty Base YouTube channel. This video is on the signs and symptoms of a kidney infection, which is also known as acute pyelonephritis. Before we talk about the signs and symptoms, let's talk about what acute pyelonephritis is. So pyelonephritis is a condition involving bacterial infection and inflammation of the kidney. It's actually going to be one of the more common conditions involved in kidney, and it can be due to an ascending infection from an underlying urinary tract infection, which is also known as cystitis. So individuals who have a urinary tract infection, in some cases, that infection can ascend up the urinary tract and ultimately infect and lead to inflammation of the kidney itself. Now, certain patient populations are at an increased risk of having a kidney infection or pyelonephritis, and these patients include female patients, pregnant patients, and patients with recurrent kidney stones. So these are patient populations that are at a higher risk of pyelonephritis. But the topic of this lesson is that there are a variety of signs and symptoms that can occur in pyelonephritis, and we're going to talk about those in the upcoming slides. So symptoms of a kidney infection or pyelonephritis will often develop over hours or over the course of a day. And one of the hallmark symptoms of this condition is flank pain. So flank pain is going to be pain on the side of the back, and it's going to be more specifically located near the edge of the rib cage. So if you were to feel your rib cage in the back at the bottom edge of the rib cage, this is where the kidney is located. And this is why we can feel pain in this area. So pain in the back toward one side, again, at the bottom of the rib cage. And this can also be known as costovertebral angle tenderness or CVA tenderness. So a clinician will often check for this by tapping their fist on this location. Now, because this is an infection, there can be fever and chills as well. So again, this is due to an infected kidney, and the flank pain and the fever and chills are the two most common signs and symptoms of pyelonephritis. Some other symptoms include nausea and vomiting. Nausea and vomiting can be very common with pyelonephritis, and often it's going to be due to significant infection. So because there is this very infected and inflamed kidney, patients can often feel very sick and very nauseous and can often vomit because of it. Another symptom that can occur is anorexia. So anorexia is simply a reduced appetite, and this, again, is common with patients who have pyelonephritis. And again, this is going to be due to infection. So ultimately, the patient is going to feel very unwell. They're not going to have an appetite, and then they also have this nausea and vomiting. So they're going to refuse food. They're not going to want to eat. Patients with a kidney infection or pyelonephritis can also have diarrhea as well. So this can rarely occur in pyelonephritis. It's not going to be as common as those other symptoms we just talked about, like nausea and vomiting. And then we can also see abdominal pain occurring as well. Now, a more common finding in pyelonephritis is hematuria. So, hematuria is blood in the urine. This is what the word hematuria means. And it's often going to be microscopic hematuria, meaning that you're not going to see it with the naked eye. So if you actually look at your urine, you're not going to see red blood in the urine. Although in some cases, there can be macroscopic hematuria, which you may see in your urine. But most of the time, you're not going to see it. It'll be found on a urine test. And this is again going to be due to organism irritation. So you're going to get some bleeding from that infective organism irritating the kidneys and some of the other parts of the urological system. And then hematuria can be so common, in fact, in pyelonephritis patients that it is estimated to affect 30 to 40% of patients who have pyelonephritis. And hematuria itself is going to be more likely to occur in females. Now, some other findings we can see with a kidney infection include epigastric pain. So epigastric pain is going to be pain in the epigastric area. So the epigastric area is the area above the belly button. This is going to be relatively uncommon in pyelonephritis, but it can occur, and it may be associated with nausea and vomiting. We can also see lower abdominal pain as well. It can be related to underlying or preceding cystitis, which would be, again, that inflammation of the bladder or that urinary tract infection that often precedes the pyelonephritis as we mentioned before. The lower abdominal pain may also be referred pain from the kidney infection itself. So even though there may be some infection in one of the kidneys, there can be referred pain down in the groin area. So this can also be a reason why we may see this symptom. And then because we talked about cystitis or urinary tract infections being a common underlying condition that ultimately can lead to pyelonephritis, we're going to see signs and symptoms of urinary tract infections. So some of these can include dysuria. So dysuria is going to be a pain often described as a burning sensation while urinating, and it is going to be due to irritation of the bladder and lower segments of the urinary tract caused by infective organisms. We can also see urinary urgency. So urinary urgency is going to be a feeling like you need to urinate more quickly or more urgently. And again, this is going to be also due to bladder irritation. And then urinary frequency can also be found as well in patients who have pyelonephritis. So urinary frequency is going to be urinating more frequently than normal. And again, this is due to that bladder irritation. So it's going to feel like you need to urinate even when the bladder is empty. So oftentimes, patients will urinate more frequently, but there will be small urine volumes each time. But even if the bladder is completely empty, there may be a sensation that you need to urinate. So again, these can be common symptoms in pyelonephritis because a urinary tract infection can lead to, ultimately, an ascending infection that climbs up the urological system and eventually gets to the kidney, causing pyelonephritis or a kidney infection. And then there are certain complications that can occur in pyelonephritis as well, and these are most likely going to occur in severe cases. So one of the complications of an infected kidney is bacteremia. So bacteremia is going to be bacteria in the blood. So there can be a systemic infection that can occur from this infected kidney. We can also see sepsis or septic shock being something that can occur as well. Multiple organ system dysfunction can occur in very severe cases, and then acute renal failure as well. So because there is this infection and inflammation of the kidney itself can become damaged, leading to reduced function of that particular kidney. So there can be some renal failure in some cases. If you haven't already, please like and subscribe for more lessons like this one. Thanks so much for watching, and hope to see you next.